Thank Anna, thank Gideon, thank all of you. I am a little scared now because I have to talk with you in my bad English. Paula said me that I don't have to say that my English is bad, but it is bad, and so I chose a strange topic uh, because I talk to you as a psychiatrist and as a former director of a mental health unit, and also as an existential psychotherapist. The topic of my presentation is therapeutic integration, its philosophy, the necessary skills of the professional who participate in it, and what the procedures should be. I have chosen to talk to you about integration because I have long been convinced that only through integrated work can we effectively contrast many psychiatric diseases. And I am convinced that the existential approach is the best way to work in integrated therapy. Today, all medical approaches consider the need to integrate medical, psychological, and social knowledge to treat all disease. But the most important problem is what do we mean by integrated therapy? For the past decades, medicine used some multidisciplinary equipes. The famous term multidisciplinary equipe, where a lot of professionals worked together. But generally, in this case, each professional worked of himself together other professionals, but without communication or very little communication among them. This kind of professional interaction is very different to an integrated therapy. What is an integrated treatment? And especially, what about mental health integrated therapies? I need, before discussing about integration, talk about the concept of some important important points. And specifically, we have to talk about illness, about care, treatment, therapy, about helping professionalism, and obviously, last but not least, about integration. Concept of illness is different between different countries. In Italian language, we have only one word, malattia, that is generally used for all the fields of this word, of what this word needs. In English, there are a lot of words for pathology. The most important for disease, that is the medical idea of pathology. Illness, the disease that the single individual feels, the patient experience of being ill. Sickness, the social role of disease. And the disorder that is considered more neutral as a as a term, as a word about for pathology. If we consider now the disease definition of World Health Organization, there are some aspects that are very important. At the beginning, health is a state of complex physical, mental, and social well-being. Physical, mental, and social, and not merely the absence of disease or infirmity. A disease is a particular abnormal condition that negatively affects the structure or function of part or all of an organism. Diseases are often known to be medical conditions that are associated with specific symptoms and signs. The definition of disease is fundamental, the principle of transience. But the WHO definition doesn't consider the existential fallout that are very important, because people that suffering from some kind of disease live with their set of symptoms, feelings, emotions every day. And the existential presence of disease affects the way in which those affected see the world. There are complex psychological anomalies that we call illness. We have also sets of feelings, thoughts, emotions that people experience as a disease. There are events experienced by those who share existential space with those who have a disease, that allow to recognize those people as individuals suffering from a disease. At last, there is the possibility that these conditions cause physical, social, emotional damage to others people. Now consider the therapy. Or better, before that, consider the general concept of care. Because there is an important difference between care and therapy. Care is a complex process aimed at providing existential meaning and repairing what is altered. So care includes taking care of oneself and others, paying attention to certain aspects of oneself or another person, improving one's own and others' skill and knowledge, preventing illnesses and negative events. So now, in this moment, now we are take care of ourselves. Also in this case. But it's complex, the passage from care to therapy. Care aims to improve the quality of life of the person in its broadest sense. It is characterized by complex behaviors that have evolved over time and are inherent to human nature. It is oriented either toward oneself or others, with interaction modalities that vary from case to case. It also involves a relationship with the contextual world and focuses on specific problems. From this perspective, within care, therapy may take place for the condition of illness. Therapy is a tool of care. Care isn't a tool of therapy. Who are the people who deal with care and therapy? We know, obviously, the helping group for professionals. But when we consider help, what is help? This is my consideration, is only mine. I think that you don't find a similar consideration in anywhere essays. I consider two kind of help. The first is vicarious help. For example, my car is broken. I don't understand anything about the car. I go to my mechanic repair my car. This is a vicarious help. The state protect us with the police. Sometimes. Okay. This is a vicarious help. The second kind is educational help. The teacher with the students. For example, the personal trainer that suggests me that I have to lose weight, and I don't listen ever this suggestion. This is the educational help. And in integration, vicarious and educational aid interact. So we have now, last but not least, obviously talk about integration. What is integration? What we consider at integration? As a general concept, integration is a process in which different skills, knowledge, and cultures organize a common action aimed to one or more outcomes. This is a definition, a classic definition. In medicine, integration is the choice to fight against disease by intervening with different strategies coordinated with each other, as in collaborative care, but also including non-medical skills. Specifically, integration in mental health care implies the management of different therapies and treatments. Today, the main perspective is one of consolidated work and study. This kind of care includes the existential aspects of the disease and the existential aspect of the patient, and the effect of the disease in the social world and in a relationship with other people. This concept, this four concept, keep in mind this four concept. Now we have to talk about mental health in general. I hope that it is now clearer to you how I understand for these four concepts. Mental health, mental illness. What is mental illness? It is the clinical condition in which the full perspective of illness, disease, illness, sickness, disorder become most evident. More in mental illness than the other diseases, organic disease. It represents the class of disease that includes all conditions of stigma. Also in this case, more of the other diseases. There is a problem, a big problem. Said Benasayag, when we see a label, we wrongly believe we know everything about the person carrying it. In psychiatric, in mental health, we have all labels. And generally, we have the concept of know all about these people with these people with these labels. The realms of care and therapy, especially in mental health care, often overlap. Mental disease share all the aspects of physical disease covered above these aspects that now I expose you. The symptomatic expression of the disease, all the symptoms, all the signs, all the syndromes, but also the relationship between illness and individuals. Because it's possible that this relationship will be very different, individual by individual. The relationship between a sick person and his or her environment. We Italians say hair on his because we are knights. Generally. Before women. The progression of phases of time and states of well-being and illness. The relationship of other people with the sick person, obviously family, friends, citizen, companies, and so workers, and so on. The social and the functional role of the individual. Different roles, different problems, different kind of care for the also for the same kind of illness. The consequences in all existential areas of the action of the therapies, and also of their total or partial absence, because a lot of problems are for the absence of the therapies. Social and existential outcomes of mental illness in terms of stigma, self-stigma, and another important stigma that generally is less considered, stigma of healthcare professionals. So is mental health care efficient and still valid today? Today, pharmacological treatment for psychiatric disorders is more effective, efficient, and better tolerated than in the past. There is a strange word for us, Italian, effectiveness, that is used in medicine. Many psychotherapies yield good results. Rehabilitation therapies improve coping skills and cognitive abilities. But the problem is that all of these treatments, all care of the mental health, all kinds of therapies, in this case, don't have a scientific validation. or a complete scientific validation, also a partial scientific validation. And this is a problem. Because for this reason, we have a lot of a limitation of care approach. For example, psychiatric approach often limited to a medical approach similar to other organic therapies. Psychotherapy approach to complex and to which little adherence is. Social intervention, often utopian or inadequate. Assisted intervention, vicarious help, passively accepted by the customers. Which solution? The integrated therapy would be the correct solution to solve these limits. In this case, the integrated therapy works for resolve these problems and these limitations. History of integration in mental health care suggests us that this methodology was born out of response to response to failures. The first ideas about integrated therapy didn't start in medicine or in clinical psychiatry, but in psychotherapist practice. And starting in the 80s. In fact, this is a quote that I find in an important website for integration in psychotherapies. This quote says, integrative therapy is a progressive form of psychotherapy that combines different therapeutic tools and approaches to fit the needs of the individual client. With an understanding of normal human development, an integrative therapist modifies standard treatments to fill in development gaps that affect each client in different ways. By combining elements drawn from different schools of psychological theory and research, integrative therapy becomes a more flexible and inclusive approach to treatment than more traditional singular forms of psychotherapy. This is very important. The singular form of psychotherapy have gaps, have problems, is incomplete to treat the mental health problems. So an integrated practice in psychotherapy approach is still a must for psychological research. This journal of Psychotherapy Integration, publishes original peer-reviewed papers consisted with 5 major pathways. Pathways are progressively more integrating. The first is common factors. The common factors are very important. It's very strange to find a training about common factors in a psychotherapy training. But it's very important to work about common factors and to take it, to train, to try to use common factors and to recognize and to use common factor. The technical eclecticism, sorry. For a lot of psychotherapy, psychotherapists, is possible to take techniques from other models and use in their models. better theoretical integration, combining two or more theories and their associated techniques. Also, better assimilative integration, and the best, unification. Meta-theoretical approach that place theories, techniques, and the principles into holistic frameworks. This is the integration in psychotherapies. The integration of biological and psychological treatments appeared later in the scientific literature. It was about at the end of 80s and the beginning of the 90s. But Fernando and I remember, I think about 1986, 87 in Montecatini. Yes, it's tried to organize a research this research as a research of an integrative therapy with training autogen of Schultz and pharmacological treatment in people that suffered of anxiety. We treated about 50 people, yes, Fernando, but unfortunately we stopped we ended the research and and Lubyanka Saffer is a psychoanalyst, and she wrote, "The association of psychopharmacotherapy and psychotherapy is a frequent clinical and often indispensable practice. From the psychodynamic perspective, there is the advantage of facilitating the understanding of transference. An integrated care approach involves medical, psychiatric, neurological, general medicine, internist, if there is the presence of pathology. Psychological approach, cognitive rehabilitation, existential clarification, counseling, and re-educational. All these approaches are the approaches for an integrative project. Now I am at the core of my presentation, because now I start to talk about the professional's attitude and knowledge to work in therapeutic integration. What should be the behavior of professionals managing an integrated therapy? Individual professionals have to intervene in all steps of the integrative procedure or project. Sharing the care of the client, stimulate focus, build the integrated care project so that it can be followed by all professionals. Sharing information on interim results, developing new objectives and new ways of sharing information. Determining processes that will be repeated several times. Managing a common outcome and follow-up procedures. And at least conducting a common analysis of the outcome. The most important tool is this. Integrated therapy can be supported only if the individual professional, as well as the entire group of professionals, adopts a common mindset. This is the most important, a mindset, a mental attitude that needs knowledge sharing, a common practice, a constant communication. It's very important, a knowledge sharing, because only that professional that knows how the colleague works, what fundamental tools he uses, which are his attitudinal principles, all that professional will be able to participate to an integrated therapy project. But also they need a specific mental habitus, the ability of epoche, and the constant self-reflection. How does integrated project develop in a professional group? The project needs operating and methodological principles, design of the integrative network, improvement of integration skills. It's very important, a common basic training on the specific operating methods. An organization of interprofessional communication, also using tools for mutual information exchange. One of these targets, or with the pre-organizing and integrated working, or keeping a network of professionals ready to intervene whenever it is necessary. And intermediate checks and the possible new designs, creating valid interdisciplinary verification tools, or developing rating skills and the quality of life, and obviously outcome and balance. And to talk now about the training, this is in this slide. It's important this a basic training program that include principle of epistemology, the basic the principles of all professional areas, possibly subject to integration, and regularity frameworks and social structures, that can support supplemental programs. And also, it's very important, training about effective communication, and a personal training that aims to implement one's own capability of suspending judgment, the famous epoche, and self-reflection to reach the correct mental attitude. It's very important, this. Okay. Oh, now, I believe that you are asking yourselves why I chose to talk about therapeutic integration in a meeting dedicated to existential therapy. For me, the answer is very simple. Because existential therapy is the best form of therapy for integration work. And for the second, because integrated therapy is the only kind of therapy that can fight the mental illness. But why existential therapy is the best choice to improve an integrated therapy projects. I want to start from Merleau-Ponty. Merleau-Ponty wrote, illness can become a general possibility of human existence. But in this condition, there are a lot of needs that generally remain as unmet needs. Needs that are often overlooked. The need to interpret the state of illness as a possible existential state. Overlooked. The search for meaning, even in the existential dimension of the individual as a patient. The narration of oneself. The narration is very difficult without limiting it to the narrative of the individual patient. The social dimension of the individual patient, the emotional dimension of the individual patient, and the management of the internal stigma. The ability to plan and project for the future. All of these needs often are overlooked. If we think about an integrated therapy with our phenomenological existential model, we can share and implementing all this approach. A clinical, pharmacological, and psychological therapy. A behavioral therapy. I call this kind of therapy life. I don't remember the pronunciation. Hygiene. I don't remember. Okay, you know. A social therapy to manage the individual's circumstances within their own existential space. An existential therapy to counter the consequences of receiving a diagnosis, to strengthen the ability to manage the illness, and to transform care into a life project. Why does existential therapy promote the integration of care in psychiatry? Existential therapy is based on a non-deterministic model, so it does not conflict with other psychotherapies based on deterministic models. So existential therapy is hyper-inclusive. Epoche is a non-invasive method of analysis. Through it, the professional adopts the mental attitude that favors the integration of knowledge and the procedures. The focus of existential therapy is the person, not the illness. And existential therapy cares for the complexity of the individual and their circumstances. Okay, colleagues, please brief a seek of relief, because the next is the last slide. I always remember the categorical imperative that Jaspers directed to the helping professional for a doctor. An imperative that I believe is at the core of existential thought, as necessary as ever for those working with integrated therapy. I like a lot this sentence of Jaspers. The doctor is not a technician or a savior, but only an existence for another existence, a fleeting human being who realizes with the other, in the other, and in himself, the very dignity and the freedom that he recognizes as norm. Words are stones. Let us not forget them, please. Okay, thank you for attention and sorry for my very bad English.
Well, thank you very much, Gianfranco. It was very interesting. And I think what I'm taking from your words is, first of all, the idea that we are better if we are working together.
Yes.
And I guess that's true not only for therapy, but generally in life.
Generally in life, yes.
Yes. And another thought that comes to mind is when we think about the training institutes. So perhaps we should include a basic understanding or acknowledgement of the other methods in order to be able to work together better in the future.
Yes.
And another thought is that if we think about psychotherapy itself, we should be open to more than one approach, integrating the existential approach with other approaches as well. And I agree with you that the existential approach is a very good candidate for this because we are open to other languages of therapy.
I am convinced that existential therapy, or better, existential food, is a meta psychotherapy. I think that is the mental attitude that needs for all help professionals. Psychiatrists, psychotherapists, psychologists, social assistants, nurses, all. And I think that it's the most important model and the most important philosophy, obviously.
Yeah. And often when I speak to colleagues who practice other approaches, not existential, when they get to know the existential approach, they often say, I work this way in my approach as well, but I didn't know that there is a name for it or that it is part of the existential approach.
Yes.
And that's, I think, also because the existential approach, belongs to all of us, to human beings. And issues like death and loneliness and isolation and freedom and responsibility and meaninglessness, they are issues that we all face as human beings. Yeah. Now, if it's all right with you, Gianfranco, I will invite people to ask or share their thoughts.
Yes, no problem, but I need of the help of Paola.
For translating, okay. By the way, your English is wonderful. That's my opinion.
Thanks. You are a very big friend of mine.
All right. So thank you, Paola, for translating.
Okay.
Any questions, thoughts? Anyone?
Actually, since I'm the translator officially, I just wanted to share my thought about being an existential therapist. My idea is that existential is something that I am or have become. It isn't something that I do to my clients. And if I am existential, because this is me and it's the way that I actually connect with people and the world around me, then it is okay for me to use other tools if and when they're necessary, which means I can integrate other skills that I might have learned during my training or my experience, because they might be good for my client in that specific moment. But I can do that because I am existential. And that, I think, gives us an incredible freedom to be ourselves and work existentially, but using whatever it is that we can use for the benefit of our clients. And I think this is incredible.
Yes.
Yeah, I agree with that. Any other thoughts, questions, comments? Yes, Dida?
Just to follow on from what Paula says, I think so often therapists feel they have to compete with other schools, or they have to, I don't know, they somehow find it difficult to share a lot. I'm just talking about being a human being, yeah? And Paula, you hit on something I think is really important, which is, and I feel the same. My views are, I don't do existential therapy. I carry it with me wherever I go in life, with my family. I can trace it back to when I was very small. So it's mine, and it's not under any threat at all. No one can take it away. And I think that's really, really important to have that confidence, I suppose. But it's just because it's not something I've gone to school and been taught. Yeah, it's something I recognized already in myself from reading, particularly Merleau-Ponty and some of the philosophers, and listening to. So I like that idea that we carry it with us, but we're confident enough not to feel someone is going to take it away. And yeah, so that makes it very, very easy to be generous, I think. Maybe not all the time because we're human. Yeah, but I think the idea most of the time.
Yeah. Thank you, Dida.
I think that we use a suggestion with our students that the psychotherapy, the existential psychotherapy, has to be a stimulation of autonomous reenactment. And this in Italian, this is an oxymoron, because if I stimulate someone, it's impossible that is work autonomically. Scusa, poi si dice Paola, io non...
Autonomously, I guess.
Autonomously, okay, perfect. But the phenomenological approach creates the center in the rapport. So stimulus and autonomic approach aren't in therapists and clients. Both are in the rapport, and in this kind of rapport could stimulate to an autonomously reenactment. It's very important. The creation of the rapport different from client, different from therapist. It's the rapport. It's the third character, the central character of the psychotherapy.
Okay. Semyon?
Продолжение того, что Джанфранко говорил. Мне кажется,
Continue what Gianfranco has said.
Мне кажется, что экзистенциальная терапия, она перпендикулярна тому основному тренду, в котором сейчас развивается медицина в современной цивилизации.
I think that existential therapy is perpendicular to the main trend how modern medicine is developing in our civilization.
И, по крайней мере, это связано с тем, что идет тенденция стандартизации и универсализации всего. Техники, технологии, приемы, они универсализируются, делаются едиными на всех. Так что скоро не потребуются люди для того, чтобы чтобы диагностировать и лечить. Искусственный интеллект вполне будет с этим справляться в связи с этой универсализацией.
It's related to the fact that in our civilization now we have a mainstream trend to universalization and unification. And we try to develop universal techniques and methods for everything, and it will cause that soon we won't need a human being for practice of any kind, because everything will be standards and unified, and artificial intelligence will be able to do this, to apply standard and unified methods and techniques.
И это еще третье усугубляется повсеместным в других направлениях, чем экзистенциальная терапия, повсеместным господством субъект-объектного внешнего подхода, того, который утвердился в течение истории развития естествознания.
And in other approaches, in approaches others than existential therapy, the subject-object model is dominating at the moment.
В то время как в экзистенциальном подходе очень важно, что устанавливается отношения, которые не субъект-субъектные, те, над которым Бубер размышлял, когда говорил о «я» и «ты».
It's important that in existential approach there is a different kind of relation. It's not subject and object relation, but it's I and thou, which Buber contemplated on.
И то, что сегодня может помогать в лечении этого человека, завтра уже может не помогать в его лечении, все меняется.
And what can help today in treatment of a client or patient, tomorrow it's maybe unuseful, not effective.
И то, что может помогать одному человеку, другому уже совсем не будет помогать. И каждый раз все по-новому.
And what helps one person, it may not help another person. Every time it's different. It's every time it's a new. In a new way.
Размышления в продолжение того, что Джанфранко говорил.
So this was my reflections following what Gianfranco said.
Thanks, Simon. At the beginning of your talk, the AI, artificial intelligence. I think that artificial intelligence is an opportunity, non a problem. In then the conference, room conference, we'll organize a discussion room about artificial intelligence and psychotherapies. Do you participate with me at this discussion room? In room?
Почему нет?
Why not?
Because I think that Semyon and I are more nostalgic, more no technical, but holistic approach, and it's interesting. Connects, and it is interesting connect an holistic approach to artificial intelligence. I think that it's possible.
Right?
Hola.
So, just a very short story about artificial intelligence. One of my clients missed a session without cancelling. And when he came to me the following time, I insisted that he paid for that session because I was there for him and he didn't show up. And he became very angry and he said that he was going to stop seeing me because he can use ChatGPT, which is always available and it's free. And also, unlike me, will actually give very good advice on how to sort all his problems. And so that was going to be the end of our therapy together. And he was very angry because of my behavior. And so I have to say, yes, it is true that artificial intelligence can be there. You don't need to book, you don't need to pay, and it will solve the problems. It is absolutely real. And perhaps this is what most people want. But I said, there is one thing you will miss, which is having an argument with me, because you will never be able to be angry and have an argument with the robot. And that's the only difference. Then he came back because he liked fighting with me. But apart from that, that is what it is. The artificial intelligence is there at the service of the client and actually solving problems. What else do you want? You don't even have to book or pay for it. And it is true. It's right. But you can't fight with it yet.
Yes.
So we have to be careful not to dismiss it so easily because it is taking place already.
Yeah. Well, the world is changing, but not the existential givens. Yeah. Any other thoughts, questions? All right. So, Gianfranco, I would like to thank you for these lectures and the presentation. And I would like also to take this opportunity and ask you to tell us a little bit about the coming conference in Rome, in Italy.
Okay.
The main themes and yeah.
I remember all that the conference will be on May from starting 21st and to 23rd. In the 21st in the evening will be also a ceremony to for the 10 years of federation in the evening. I hope that will be also a little beautiful classical music concert and it's important for all the participation as your proposal of your lectures, send me a lot of abstracts. We have now about 15 abstracts that are different from the lecture of the keynote speakers, but we have a lot of space for your proposal, your posters, your short communication, maybe also your workshop. In the conference, there will be some discussion rooms. Discussion rooms is a little space, about 2 hours, no more. That in this room we discuss about a topic, specific topic, and all participants could register for the discussion rooms, and in this case, with the registration, the single have the possibility to have a space for 5-10 minutes to talk about that topic. This is a similar with a lecture, but is very free, with no this isn't necessary abstract or other. And I think that this is a new kind to discuss between us, among us, and I think that it will be very important the moment when we have the round table about the training in the psychotherapy schools, because it's very important for also for topic as the topic that about I talked this night. Because it's very important that we talk about the training, because I think that the training are very different school to school, between among all schools, also because are very different the country laws about psychotherapy. It's very different. Are very different also the pathway for the psychotherapy. It's very important that we discuss about this. Okay. I will be very happy to see you and to hug you all in room. That is one of the most beautiful seat in the world.
Excuse me, Gideon, may I?
Of course, please.
Okay, well, about the celebration, it's not established that the concert for the fetus decennials is classic music. I'm thinking to a jazz concert, and it rests to decide between Gianfranco and me. I think I win. You can vote.
Okay. Good.
Oh,
it's been a pleasure.
One on Wednesday, another on Thursday. Okay.
Yeah. I think that in many ways the conference resonates with the presentation you gave us this evening. It's about learning to work together and learning how our colleagues work and get better together.
Wow.
Yeah.
Okay.
And learning from our previous conferences, it really is a wonderful chance to meet people from other countries and learn how other people do existential therapy in other countries. which is wonderful. Yeah. All right. So I would like to thank you everyone for coming this evening, and I would like to invite you to visit PET's Facebook and PET's website, and I'm very much looking forward to seeing you in Rome on May 2025. Thank you, and good evening, everybody.
A nice evening to all people.
Thank you very much.
Thank you.
Bye.
Thank you.
Thank you.